Okay, so first I would gather my supplies, wash my hands, introduce myself to the patient by saying, "Hello, my name is Adrian and I'll be your student nurse." I'd ask two identifying questions such as, what is your full name?
Nicholas Rivnak, and I consent to be on video.
And date of birth?
1/27/99.
I would explain the procedure, which is a head-to-toe assessment, and then I would provide privacy. So Nick seems to be a healthy young male, well-nourished, normal skin coloration. Body is proportional. He's sitting up straight, erect, relaxed. He is smiling at me, giving me eye contact, and his mood and behavior is appropriate. He is well-groomed and clean. And since he already answered my question of full name, I would ask him approximately what time is it?
3:45.
Where are you at?
Your room.
And why are you here?
For a head-to-toe assessment.
Okay, so he answered all my questions correctly, so I would say he's alert and orientated ×4, and he is conscious. His speech was clear and well articulate. It was easily to understand. And now I would assess for pain. I would ask the patient if he had any pain, and if so, what would you rate it on a scale of 1 to 10?
I have no pain.
Okay, so if the patient had pain, I could use the acronym Code SPA to assess for character, onset, location, duration, severity, pattern, and any associating factors. So now I'm going to take your radial pulse. Okay, so it's regular and elastic. I would grade it a +2, and now I'm going to count for 30 seconds, starting now. Okay, so I got 80 beats per minute, which falls in the normal range of 60 to 100. And again, it was regular, elastic, and I would give it a +2. Nick's breathing is unlabored. It's regular and at a depth of 1 to 2 inches. I'm going to have you put your arm across your chest, and I'm going to assess for the respiratory rate. And since it was regular, I will count for 30 seconds again, starting. Okay, so I got 14, and this falls in the normal range from 12 to 20. And again, it was unlabored, regular, and at a depth of 1 to 2 inches. Now I'm going to take the blood pressure. Is there any restrictions that would prohibit me from using an arm, such as dialysis or a blood clot?
No.
Okay, and do you know your normal blood pressure?
120/80.
So I'd make sure to pump it up to 150. Okay, I'm going to move his arm, and I make sure the patient's arm is at chest level. I'm going to palpate the brachial artery. So I got 116/78, which falls in the normal range. For systolic, it's 90 to 120, and dystolic, it is 60 to 80. So now I'm going to assess his face. So skin color is normal. It's normal skin coloration. There's no redness, no edema. His eyes are symmetric. His nose is midline. His ears are also symmetric. You can tell because of the corner of the eye aligns with the ear. I'm going to have you puff out your cheeks, raise your eyebrows, smile. Okay, so eyebrows, eyes, mouth, nose were all symmetric and intact during motion and at rest. So now I'm going to have you pull down your eyelid for me. So sclera is white throughout, conjunctiva was clear and pink. I'm going to have you watch the tip of my pen light as I move it in 6 positions. Watch with your eyes and not your head. Okay. Okay, so eyes move symmetrically and smoothly through all 6 positions. There no signs of nystagmus. Now I'm going to measure your pupil size. So just look straight ahead for me. Okay, left pupil is about 4 millimeters. And right pupil is about 4 millimeters as well. So they were equal and round. Now I will have you look straight ahead over my shoulder, and I'm going to test for reactivity to direct lighting. So just look straight ahead. Okay, left pupil constricted with direct light. And right pupil also constricted with direct lighting. So now I'm going to have you do the same thing, and I'm going to test reactivity to indirect light. So shine the light in his left eye and check the pupil to see if it constricts in his right. So just look straight ahead. Okay. Okay, so both pupils constricted with indirect lighting. Now I'm going to have you watch the tip of my pen light again as I move it. Okay, so eyes converged and pupils constricted with accommodation. So pupils were equal, round, reactive to direct light and indirect light, and accommodation. Now I'm going to have you put your arm straight out for me. Okay, so there's normal skin coloration, there's no redness, skin is intact, and I see one primary lesion in the form of a freckle, and it's pinpoint, and there's only one, and it's flat. There's no secondary or vascular lesions. Now I'm going to palpate your arm, and let me know if you have any pain or tenderness while I go over your joint. Any pain? Okay, so patient didn't have any pain, and I did not notice any edema at this time. Now I'm going to have you turn that way, and I'm going to check the chest. Take off your shirt. Okay, so spine is midline. There's no curvature, and it's straight. Ribs slope at a 45-degree angle. I'm going to test for chest expansion, so I'm going to have you inhale and exhale. Okay, so chest expansion was equal and symmetric. Now I'm going to auscultate 10 positions on the posterior thorax. Okay, I will make sure not to go above the bone, so take a deep breath for me. Okay, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, I'm going to have you lift up your arm, and I'm going to listen. Okay, deep breath. Okay, so posterior lung sounds were clear bilaterally through all 10 positions. I did not hear any crackles or rhonchi at this time. I'm going to have you turn around and I'm going to auscultate the anterior. Okay, I'll make sure to avoid the clavicle again, so deep breath. Deep breath. Okay, I'm going to have you lift up your arm. Okay, so anterior long sounds were clear bilaterally through all 10 positions again. No crackles or bronchi noted. Now I will listen to the heart sounds. So I'm going to start on the right side of the sternal border at the aortic. And this is the second intercostal space. Okay, and I'm going to move directly across from that to the pulmonic, which is left of the sternal border, and it is the second intercostal space. Okay, down in intercostal space, third intercostal space, left of the sternal border is Erb's point, so I'm going to listen there. Okay, down in intercostal space, the fourth intercostal space, left of the sternal border is the tricuspid, so we move down. Okay, and the last intercostal space, the fifth intercostal space, is the mitral area, and it's midclavicular, and it's left of the sternal border as well. Okay, so heart sounds were strong and regular. I did not hear any murmurs or S3 or S4. S1 was heard loudest at the apex of the heart, and S2 was heard loudest at the base of the heart. So now I'm going to have you lie on the bed. I'm going to inspect the abdomen. Make sure to drape the patient's chest. Okay, so umbilicus is midline. It's recessed, making the four quadrants equal. There is no primary or secondary or vascular lesions noted in any of the four quadrants. I'm going to. The contour is flat. It's non-distended. There's no pulsations noted. Do you have any pain or tenderness in your abdomen?
No.
If the patient had pain or tenderness in their abdomen, I would make sure to go to that quadrant last, but since the patient doesn't, I will listen or auscultate in the right lower quadrant first. So I'm going to pull these down if that's okay. Okay. Pull this down again. Okay, so I heard intermittent clicks and gurgles in all four quadrants at a frequency of about 8 to 10. And this is a sign of active bowel sounds. Do you have any pain or tenderness again in your abdomen?
No.
Okay, so now I'm going to palpate the abdomen. I'll pull it down a little bit again. Any pain or tenderness? Okay. Okay. Okay, so patient stated that there was no pain or tenderness, there was no guarding, no distension, and abdomen was soft uh, and there's no rigidity to it. So now I'm going to, you can put your shirt on now, I'm going to go down to the legs. You don't want me to, okay. Okay, so there is a slight color deviation. His upper thigh is lighter than his leg, and can I take off your socks? Okay. And his feet are whiter than his leg. There is normal. There is hair scattered throughout. There is a secondary lesion in the form of a scar on. It's inferior to the patella. It's on the anterior side of the leg. There's no redness from it or anything. Now I'm going to palpate your leg, okay? Okay, so there is no edema noted and skin is dry and warm. Now, do you have any pain or tingling or numbness or tingling in your legs or feet?
No.
Okay, so now I'm going to have you point your toes towards me and point your toes towards you. So I just assessed for dorsi and plantar flexion. Now I'm going to look in between your toes. Okay, I'm going to check underneath your leg and your heel. And skin is intact, there's no redness, no signs of ulcerations at this time. Now I am going to palpate the posterior tibial artery. So it's regular and elastic, and I would give it a +2. Now I'm going to move down to the dorsalis pedis, which is in between the two toes, the first two toes. Okay, so it's regular, it's elastic, and I would also give it a +2. At this time, I would assess if there's any IVs or Foley's or oxygen, and there's none at this time, so I'd make sure the patient is in a comfortable position. Items are in reach, collar is in reach, bed is in the lowest position, side rails are up ×2, and then I would document all of my findings.